It means everything to me to be part of DAP Health. It was established in 1984, originally for helping people with HIV/AIDS in the early epidemic, founded by volunteers mainly.
It was people coming together to celebrate life and looking for hope, really, because there was no hope. Out of that despair grew community.
We are DAP Health.
DAP Health is a center of gravity for Coachella Valley and Palm Springs. We're opening welcome arms to people of all races, all levels of incomes, marginalized populations.
Thank you for calling DAP Health. How can I assist you?
As an oppressed and marginalized community, we know what it's like to be stigmatized and to feel the discrimination around healthcare. So we are really poised to use all of the skills that we developed over the decades to create a space that is truly welcoming and safe for everyone.
At DAP Health, we know that wellness brings hope and hope brings health.
My goal for my patients is to feel empowered, especially working with people who are transgender and gender diverse. A lot of my patients have had trauma. One of the ways that we can really empower patients is by partnering with them and letting them know that they have that voice, and all I need to do as a clinician is to amplify that voice.
Public health is vital to DAP Health's mission, which is to enhance and promote the health and well-being of our community. Public health is understanding that there are people in the community that may be underserved. That's why DAP Health is fully committed to health equity.
Equity brings everyone at the same level playing field, which is much more difficult goal to achieve. It's sort of the opposite of, here's the program, now how do we fit everyone into our little pegs? It's like, oh, here's the person. How do we take our organization and make it work for that person?
Not everybody has the same access. When you take the programs that DAP's created, whether it be healthcare or dentistry or housing, and then you tie it together with a case manager, you can achieve health outcomes otherwise unpredicted.
You are all set, okay?
We are a qualified health center that's open up to the entire community. We obviously have a focus on HIV and AIDS care, but we provide all spectrum of medical services. We now offer full comprehensive primary care and preventative health care services for adults 18 and over.
The patient-centered model of care is where we provide everything that the patient could need to make their care holistic. It's really approaching the patient from multiple directions.
We listen to our patients. We work as a team. We want to be partners with our patients.
It's very rewarding to help people in that way. Coming in regularly for dental checkups is a good thing.
So today's just going to be an exam. I'm just going to be checking your teeth.
Having those exams once a year is just like getting a regular physical exam and seeing your regular primary care physician.
We provide primary care, access to infectious disease specialists, psychologists and psychiatrists, dentistry, affordable housing, nutrition and food, case managers who tie it all together. And we overlay it with holistic practitioners, acupuncturists, chiropractors, massage therapists, meditation teachers, and the like. We know that it takes a varied group to heal somebody.
It reminds me of a conversation I had. I was asked, do you provide specialized care? And one of the things that I say, without a doubt, I do. All of my patients are special, and I provide specialized care for each and one of them.
They feel like they're given the time, they're given the access, and they're given the resources.
The healthcare system, social services, the entire system is complex. DAP Health and our staff are well equipped and trained to help navigate anybody that walks in our doors and help guide them through their journey.
And how about the referrals department?
When the COVID pandemic arrived, we immediately moved to the virtual visits and telephonic visits if patients were not able to do virtual visits. Virtual visits are when we can see them, hear them on the video camera and communicate and be able to provide them care remotely in a safe setting. Same thing with the telephone. We were able to never stop caring for our patient and to provide care remotely and safely.
The beautiful thing about the mobile unit is we're able to go to communities and really meet them where they are.
There's such a need, and we really want to make it accessible to everybody.
Sometimes it's really difficult to reach out for help, especially when you're in the throes of a deep depression or highly anxious. You may not even think that you're worthy of reaching out, or may not know where to start to reach out. But it's really important to recognize that DAP Health is just one phone call away.
This is a safe place, where you won't be judged.
Pronouns really do matter. Sharing what your pronouns are creates that safe environment. I always preface the visits with my patients that you tell me when you're ready to tell me the answers to the questions I'm asking.
In order to really have true wellness, we need to have both mental health and physical health. They are integrated.
If we're not taking care of one, it impacts the other. We have nothing to be ashamed about when we're taking care of our mental health.
We're a human rights campaign, LGBTQ+, equality, top performer. That's a national recognition of our ability to care for a very diverse community in a comprehensive and welcoming healthcare environment.
DAP Health welcomes all people.
We welcome all people, period.
Period.
We are here to care for everyone. We have trained clinicians to take care of all your needs. So give us a chance.
At the end of the day, it's about doing humanitarian work. That experience that we create is from the heart.
Every patient that walks in the door, I see myself in them because I once was homeless and I was doing everything to survive. It's why I do what I do, and it's to serve the community because I want to make sure that the me 10 years ago is going to be well taken care of.
I grew up with very little health care, and I always knew that I wanted to make a difference in healthcare. And we're all so proud of this organization and how we can contribute and continue the legacy.